It's morning. You open your eyes. In the back of your neck, the facet joints feel strange. They are fused, thus limiting movement of your head. You try to move other parts of your body. You try wiggling your toes and realize that your big toe feels strange. Looking downward, you notice that they are short, bent, and curved inward. You become aware of a sharp pain in your shoulder, upper back region, in which you notice is inflamed and swollen. Your arms are locked into place and you can't move them freely. You have FOP, or also known as the Stone Man Syndrome. When a typical person is born, there are several genes that turn off and others that turn on. In the case of a patient with FOP, one gene in particular never turned off. This is the bone-growing gene. Fibrodysplasia ossificans progressiva, or FOP for short, is a rare connective tissue disorder affecting only 800 patients or every 1 in 2 million people worldwide today. Connective tissue such as muscle, tendons, and ligament connects and supports other organs. In FOP patients, any sort of trauma or stress to connective tissue causes it to undergo a metamorphosis into bone, locking joints in place and making movement difficult or impossible. Dramatic episodes result in flare-ups or massive swellings. The results of a flare-up is abnormal bone growth. Flare-ups can happen anywhere in the body, at any time, and often caused by blunt trauma resulting from cuts, injections, or bruises. Influenza and influenza-like illnesses often provoke flare-ups. Neither medicine nor therapy can stop it. All muscles, ligaments, and tendons can be affected except organs and tongue. The P in FOP means progressive, so the older people get, the worse the condition becomes. The earliest case arose in the 17th and 18th century. In 1692, the French physician Guy Patin documented a patient who suffered from FOP, which was the first on-file record of his disorder. Initially, the disease was known as mitosis ossificans progressiva, which means muscle turns progressively into bone. The name was officially modified to fibrodysplasia ossificans progressiva in 1970s by late Dr. Victor Munscoot and Johns Hopkins University of Medicine in order to acknowledge that other soft tissues in addition to muscle, for example the tendons or ligaments, are replaced by bone. In some cases, abnormal development of bone lead to progressive deformity of the spine, including side-to-side and front and back curvature of the spine. As mobility begins to deteriorate, individuals with FOP may exhibit increased susceptibility to respiratory infection or heart failure. FOP is a congenital condition, meaning it starts before birth. There are no ethnic, racial, or gender pattern as to who is affected with FOP. FOP is inherited as an autosomal dominant trait with complete penetrance. Dominant genetic disorder only need a single copy of the abnormal gene to inherit from either parent to result in affected offspring. In other words, the risk of passing the FOP mutation is 50% for each pregnancy to an unborn child. FOP can also be caused due to a new mutation or gene change in the affected individual. As of April 2006, an international team of researchers led by Dr. Eileen Shore at the University of Pennsylvania identified the genetic mutation that causes FOP. The gene for a receptor called ACVRI, which is responsible for giving instructions for the production of a protein receptor found in many human tissue, including skeletal muscle and cartilage, and controls the making of the bone from stem cells which are activated upon injury.